शङ्खं चक्रं जलौकान् दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यां शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तन् निखिलगदवनप्रौढदावाग्निलीलं ब्रह्मणो हि समारब्धा मात्रेयाद्येषु पूजिताम् अस्मदाचार्यपर्यन्तां वन्दे गुरुपरम्पराम् रागादिरोगान् सततानुषक्तान् अशेषकायप्रसृतान् शेषान् औत्सुक्यमोहारतिदांशघान यो पूर्ववैद्याय नमोऽस्तु तस्मै. So, the organizers, the students, participants, it's my pleasure to be here to deliver lecture on cancer in Ayurvedic perspective. So, we go ahead. Can you operate from here, there? This is forward. Okay. So it was first case in 1985 at the age of 67, and sonography was very new at that time. So sonography was done and they found a lesion arising from gallbladder. Wanted to operate, so opened up and found that it is not possible to do any kind of operation. It had already entered into liver and colon. So they sutured back and left the case. And the patient was discharged saying that he has only 15 days of life and nothing can be done. But the surgeon somehow said try Ayurveda. So they started searching and one of his relative was my student. So he came and asked me whether we can do anything. I said there is no harm in trying anything or something like that. So let us try. I also took advice from my Guru Vaidya Kolatkar and he said we'll start with Hirakavasma and only milk diet. So Kshirakrutabhyasa Rasayananam, that is the sutra. And anyway, the patient was having nausea and he was not having any desire for any kind of food as such. So he was very pleased that no food, only milk or something like that. And then the patient gradually improved and he survived for 33 years. He died at the age of 99. So that was a miraculous recovery, and that started fetching me more patients. Then another remarkable case that I noticed was in 1993. It was pancreatic head cancer with medicine liver, and they took advice. They were told that with surgery and with chemo, the expected lifespan is 2 months. Fortunately enough, there was one oncosurgeon who was his relative, and he said nothing doing, we won't go for allopathy at all. If we are going to get only 2 months of life, even after surgery and chemo, there is no point in going for allopathy. So he suggested to go for either Ayurveda or homeopathy. And then they consulted few homeopaths and Ayurvedic physicians, and ultimately selected Vaidya B.P. Nanal, who is a renowned practitioner, who was a renowned practitioner in Pune in Ayurveda. So his treatment started, he survived and it went fine for 3 years. So 1993 to 1996 he was under his treatment. Eventually Dr. Vaidya Nanal stopped his practice due to old age. So then he shifted to my clinic from 1996 to 2004. He was under my treatment. Only biliary bypass had to be done in 1996 initially. And thereafter, in 2004, he said now he is tired of taking medicine, and so he left medicine actually. Still everything went fine till 2009, and then he had some business loss and tension, etc. So he had drinking, and that worsened the problem, and he started vomiting and severe stomachache. So he was brought to Pune. He was actually from Silvassa, and we admitted him in Ayurvedic hospital in Pune, and treatment was given. And again he recovered from that, and 1 year he was fine. Again the same episode happened, and he again had vomiting and pain. And then new cancer, neuroendocrine carcinoma, was detected at that time, and he eventually died after 1 year of that. So he survived from 1993 to 2011, and 18 years. Surprisingly, the tumor size did not change at all. It remained the same as what it was in 1993. It didn't increase, but even didn't decrease at all. But he was leading normal life, and he was carrying his business. So this is a good thing that we have to remember, that the parameters of cancer may not change in spite of very good quality of life, and this we have to bear in mind, and this we have to convey to the society as well. Then there was another experience in Germany, a 22-year girl suffering from malignant melanoma stage 4 reported to me. Actually, I used to conduct lectures from 9 to 5, and thereafter I used to do lifestyle consultations. So she was a German lady, and one of our German students brought her actually. And she had completed 3 chemos and was due for 4th chemo. And when I asked her for her lifestyle, it was very erratic. So getting up at 11 in the morning, lunch at 5 p.m., dinner at 12 o'clock at night, and she used to watch TV from 12 to 3 at night, and on top of this she was smoking 30 cigarettes a day. So, and then she had various other problems. She was not passing motion 5-6 days or something like that. There was no appetite, there was no energy, and nobody has bothered to ask these questions to her. So I said, if you continue with this lifestyle, there is absolutely no hope, you will die within 1 or 2 years. But then she said, okay, I will follow whatever you say. So I asked her to get up early in the morning, go to bed early in the night, to use resins and things for relieving her constipation, start with yoga practices. So whatever was possible that I advised, and said, okay, I am here till 10 days only, you can revisit, we will have follow-up after 7 days, and then we decide. So she came after 7 days, and she was better. So the constipation had improved, she had bit appetite, energy level had improved, and she stopped smoking. One important thing is she stopped smoking. So then I said, okay, you continue with this lifestyle, and I returned. I went again after 1 year, and she came for a follow-up, looking better. So I asked, what about your chemo? And I was surprised to note that she didn't require chemo for the whole year. I also didn't expect that a stage 4 cancer patient would remain without chemo for 1 year, only with changes in lifestyle. So I said, okay, that's fine, you continue. I came back again, and I went again after 1 year. She again came for a follow-up, and it was the same scenario. She didn't require chemo in the second year also. So this was quite inspiring for me, and I decided to establish a website after that. and the website was released at the hands of Dr. Marshall in Dinanath Mangeshkar Hospital. It was health-ayu-world.com. Now it doesn't exist. I have established new website, gadgilayurveda.com now. So from this onward, from the first case onward, I am getting varieties of cases of cancer, all types of cancer. So main are breast cancer, ovarian cancer, liver cancer, colon cancer, brain cancer, lung cancer, tongue cancer, oral cancer, other oral cancers, prostate cancer. These are main. Still there are neuroendocrine and osteosarcoma, etc., etc., soft tissue sarcomas, osteosarcomas, etc., and leukemias. So varieties of cases. I am treating daily. I am having 2-3 new cases of cancer. So this is the scenario right now. So mostly in advanced stage. Generally people will turn towards Ayurveda only when there is no ray of hope in allopathy for any disease. It might be cancer, it might be pratishayak, shwas, pitta, asandhigata vata, whatever it may be, or something like that. So very less life expectancy. As I explained, only 15 days or 2 months, etc. These cases are more. I have faced cases with only 2-3 days survival or something like that. Various symptoms associated with disease also due to chemo and radiation. So this is a big issue, that there are not symptoms only of the disease, but there are symptoms due to chemotherapy and radiation, and also symptoms due to depression. Because when there is no ray of hope, then patient is bound to get depression. Depressed and stressful state of mind, doubts about Ayurvedic treatment and diet, that is yet another important aspect. Because in conventional medicine, there is absolutely no thought process about diet or behavior, etc., etc. Nobody bothers to ask what the person is eating, how is his lifestyle, etc., etc. The conventional medicine says that this is a lifestyle disorder. Neither the conventional medicine, not even Ayurvedic doctors are insisting on lifestyle. There was one meeting held in Pune recently, and only I was speaking about lifestyle. All others were speaking about finding a molecule for cancer in Ayurvedic method or something like that. So this is really sad that our most important thing is holistic approach. That is one important aspect of Ayurveda. That is comprising of the lifestyle, the food habits, the psychology, etc., etc., or something like that. And not only Ayurveda, yoga and other things also to be incorporated into that. So there are doubts about, and then efficacy of Ayurvedic treatment or something like that. When everybody is saying there is no ray of hope, how am I going to be treated with Ayurveda in this last stage, advanced stage, etc., etc. And then unaffordability. People have spent already lakhs of rupees in chemotherapy and other treatments in allopathy, and then they are scared about the cost of Ayurvedic medicine as such. So let us go to the root, diagnosis of cancer in Ayurvedic perspective. Now this entity is from conventional medicine. Cancer, the name itself, is from modern medicine. So there can be 2 approaches. One is integrated approach and only Ayurvedic approach. So mostly people will try to go for integrated approach. So we'll see the difference between these two. So in integrated approach, acceptance of theme of conventional medicine regarding cancer. So uncontrolled growth of abnormal cells. This is a very simple definition of cancer. Consideration of signs and symptoms, prognosis according to conventional medicine. Now this is readily available according to the stage, etc. And based on that they say that the person is going to survive these many days or something like that. The prognosis of the person is decided. Now if we want to go for only Ayurvedic approach as such, then Ayurvedic approach is Nidana Panchaka. So we have to start from Nidana. What are the causative factors? And this aspect is totally neglected by conventional medicine. So Nidana, Purva Rupa, Rupa, Upashaya, Samprapti, these are to be considered in Ayurvedic diagnosis as such. And then there is another issue, consideration of cancer as a single entity or multiple entity. So, though there is a classification of cancer in conventional medicine, and there are things which are local, there are things which are systemic, there are things which are local and systemic or something like that. There was one case of malignant melanoma I was treating, and initially when the first mole started growing, they did the biopsy, confirmed the diagnosis. That mole was removed. Second was removed, third was removed, and this went fine till fifth mole. And after removal of fifth mole, there was a spread, spontaneous spread all over the body. More than 300 moles were on the body, and one had become big like a coconut. It was in the not scrotal, near anus or something like that. And it was it was painful. He had to take photogesic every 4 hours. It was oozing, and there was very bad smell to that. So main symptom was this particular mole which had grown like a coconut and it was very painful. So it can be said that the initial removal of the mole, treating it as a local thing, was not true. It is a systemic disease, and it may erupt anywhere else in the body and may have the symptoms like this. So just treating it with surgery and removing it or giving radiation at a local point doesn't serve the purpose. If it is a systemic disease, then you have to go systemic route of administration of medicines, etc. So we have to bear it in mind that whether it is a single entity or these are multiple entities. Vaidya BP Nanal found that there are around 27 conditions which resemble with the Ayurvedic text, and he treated one case of leukemia, acute myeloid leukemia of Vaidya Dr. Gadgil, who was a professor in our college, Tilak Ayurveda Mahavidyalaya. And he diagnosed him as Astimajjagatavata or something like that. So he tried to identify certain similarities with Ayurvedic diagnosis, and he said they were 27. Unfortunately, his writing is not at all available, so this is just only what I have heard from him, but nothing in writing is available. But still, he had something common in all these 27 varieties. He was using Vaikaranta Bhasma actually in every case. So something was common in his mind, though he identified 27 conditions like this. So in integrated approach, there are certain advantages. One is ready concepts from modern medicine. So we may not have to think about cancer in a different way or something like that. We have a ready concept from conventional medicine. Only thing is we have to think what's the reason behind the transformation of a normal cell into an abnormal one, and what triggers the proliferation of this abnormal cell. These are two things that are to be required to be thought in Ayurvedic process. So correlation with Ayurvedic medicine, multiplication of cells is associated with Ojas and Shukra. Actually, the function of Shukra is Prajotpada, and that's the main function. But Pulatkar sir was having a view that Shukra is responsible for regeneration, and it is the regeneration of the dhatus as well. Parasparopasamstabha dhatu sneha parampara. Purva dhatu param kudyat buddha kshinascha tadvitam. That is another aspect. And so Shukra is responsible for regeneration of all dhatus as such, and this fact has been made clear particularly in Varnachikitsa by Sushruta. Strinam tu subritsansarusha darshanesh chalite srute shukre vavayajan doshan asamsargepi amapnayat. So while treating a wound, one has to take care about the Shukra dhatu and even if accidentally it goes out or something like that, that would be troublesome and that would prohibit healing. So the Shukra has to play a role even in wound healing and even in other conditions. And in Raja Yakshma we have two kinds of sampraptis, starting from Rasa and starting from Shukra. Ati vyavayino api kshene retasya anantara shiyante dhatavasare tatashushati manava. So this is pratiloma samprapti as what they say. And that is how Shukra is responsible for regeneration of the previous dhatus. So Shukra has to be considered in this proliferation of abnormal cells. And if the Shukra is Vikruta, then the proliferation will also be Vikruta or something like that. And second thing is Oja. Nishpadyante yato bhava vividha deha samshrayaha. So the generation of different kinds of bhavas is from Ojas, and that is why Ojas is also particularly important. Then particularly in leukemias, we see that there are abundant WBCs, immature WBCs, and the count can be as high 1 lakh, 2 lakh, 3 lakh, 4 lakh, like that. So there is Dhatu Vriddhi so called without any quality as such. On the contrary, it is dangerous to the body. So tesham sarvati dibdibdham dhatu vriddhi kshayodbhava. Swasthanastasya kayagne ramsha dhatusya samshritaha. Tesham sarvati dibdibdham sadhatu vriddhi kshayodbhava. That is what Vagbhata says about this Dhatvagnis. So if there is Dhatvagni mandya, sadha, then there is Dhatu vriddhi. And this can be very well explained when we are cooking rice or something like that. If we put more water or the Agni is less, we stop it in between or something like that, Agni in Manda, then apparently there will be more rice, but it doesn't have the quality because it is not properly cooked like that. So if there is Dhatvagni Mandya like this, which is very clear regarding this immature cells in leukemias, then the Dhatvagni Mandya would be leading to cancer, and this might be true even for other dhatus as such. So we can correlate like this along with the Ayurvedic concepts, the conversion of normal cell into an abnormal one and then the growth of that one. Ready knowledge of experiences of stages and prognosis from oncologists or from oncology books. So this is also possible, but this can be misleading. All cases that I explained where the conventional medicine said only 15 days life, only 2 months life or something like that, and we could supersede that. So this might be confusing. We should have our own parameter for deciding about the prognosis of the disease, and we should stick up to that. Based on the prognosis of the disease, Ayurvedic samprapti can be judged. Now this is another important aspect. There was one case of lymphoma and this cervical and neck glands had increased, and there was Yakrut Buddhi, 8 finger, spleen, 4 finger, and it was stony hard. So I started with Hirak and Tamra and kept the patient on only milk diet. And he tolerated it well, and he was consuming 2 liters of milk a day. Everything was fine, and every week there was a reduction in the size of liver and spleen both. So in 1 month's time, the spleen was not palpable, and the liver had come to 4 fingers, from 8 fingers to 4 fingers. Now I just casually told this fact to Kolatkar sir, and surprisingly he had a different thought process. He asked me that you are saying that it is stony hard. I said yes, it's really stony hard. Then he said this is the Vimarga Gamana of Asthidhatu. Now in Pliha Vruddhi or Plihodara, there is a mention, Shonitam va rasadibhyo vivruddhantam vivardhet. So, rasadibhya vivruddham shonitantam plihanam vivardhet, that is the Anvay. So, Rakta increased due to Rasa Adi, not only Rasa. Rasa increased and then the Rakta increased, it is normal. But Adi. And Chakrapani Datta says that Mausa etc. also increase Rakta and that ultimately increases Pliha. And there is a custom of using Agni Karma for Pliha Vruddhi, even in villages today. And Agni Karma is not the treatment of Rakta Dhatu as such. Agni Karma is the treatment of Mausa. Mausa Janantu Samshuddhi Shastra Ksharagni Karma. So it is the treatment for the Mausa. And no doubt it helps. So in that scenario, we may have to diagnose it as Mausa Vruddha Vakta Vruddha Pliha or something like that. So considering this stanza, Shonitam va rasadibhyo vivruddhantam vivardhet, we have to refer it as Mausa Vruddhijanya Pliha Vruddhi or something like that. And in this scenario, Agni Karma is useful. So like that, if it is Asthidhatu or something, then we may consider it as Rakta has increased due to Vruddhi in Asthi and that has given rise to Vruddhi of Pliha or spleen. So then he suggested, okay, considering that it is Vimarga Gamana of Asthi, let us go for Basya Kshira Sarpimshi Tiktapopahitanicha. So let us start with Guruchi Siddha Kshira and Mahatikta Gagurta together. So I started that in that patient. Now, for the first time, I opened up the book on cancer. I have not read a single line from oncology. I have not read a single line from allopathy as such. So I am totally in Ayurveda and Ayurveda only. I have not gone further. Whatever knowledge that I have is from the case papers and the reports that I am getting or something. So for the first time, I opened the book on oncology, and then this lymphoma has a further metastasis in skeletal bones. That was the thing. So this confirmed that the Samprapti was going towards Asthidhatu as such, and we started with this Guruchi Siddha Kshira and Mahatikta Gagurta as such. This case was in many ways more important. This is just out of this focus, but I will just complete and then go ahead. Though there was very good response, and actually they had already consulted allopaths and they said nothing can be done in this particular case. Still his son came to me and he said, I am shifting my father to my brother's house in Kolhapur. I said, why you want to shift like that? For a while he kept mum, and then he said, I know that there is no treatment in allopathy for this, and with your treatment he is improving a lot, there is no doubt about that. But still, my family members are of opinion that I am trying to save money using Ayurveda and killing my father. These were the words. So it was very shocking for me. You see the scenario, what the society considers Ayurveda. I said Ayurveda is for making you live, not to kill you or something like that. But he didn't accept it, and the case left, and actually he didn't turn back again. Anyway, this was the social aspects I will be dealing afterwards, but this is a social aspect, and this is a long back story. So now the situation has much changed, but at that time this was the scenario. Based on the prognosis of the disease, the Ayurvedic Samprapti can be judged. So if we can judge the Samprapti of this particular thing, then that will be advantageous for us. Shall I get some water? Integrated approach, disadvantages. If modern medicine base changes drastically, we'll have no ground. If our system is based on that, then we'll absolutely have no ground about that.